Would you consider joining the military if you were able to pick your dream career? Not your dream job, your dream career. And while we at it, you're able to get a whole profession out of it. Talking hands-on experience straight out the gate. If you're considered joining the military and you're looking for medical MOSs other than the typical medic, then this video is for you. And you're going to want to watch it all the way to the end because I'm about to drop my 4 best medical military jobs. Everybody, it's Army Princess here, U.S. soldier. I've been in the military for over 10 years now, and I love to share my experiences with you to help you all become the best soldiers you can be. You may want to consider subscribing right now because I drop military related videos every single Monday, and I usually drop other type of content on Friday. So make sure you tap the notification bell and hit all so you don't miss an upload. Now I'm going to need for you all to do something for me as well, because I'm about to be in this video, I'm about to drop some knowledge. I'm about to drop some knowledge bomb because it is not a secret that I would have picked a different MOS had I known that there were other MOSs out there when I went away to MEPS to pick my job. I don't want this to happen to you. I want you to be informed. I want you to be in the know. I want you to know what's out there and what's available to you. So with me dropping these next 4, like, I consider these my top 4 picks on a medical MOS other than the medic. I need y'all to do a little bit something for me. I need y'all to watch this video all the way to the end, number 1, because I'm going to be dropping jobs all the way to the end of the video, and you don't want to miss one of the jobs or one of the MOSs. But what that does is it really helps out my channel. It helps bring up my watch time. It helps bring the engagement. The second thing I'm going to need for y'all to do is drop in the comment section below not only the green heart emoji, because I know if you are part of the Army Princess platoon, you know what the green heart emoji is, but I need y'all to drop in the comment section which one of these 4 you think would be the best job for you. If you know somebody that was doing that job, or if you're just considering, or if you were like, hey, I'm going to join the military tomorrow, and if I had to join, this is the best job. Let me know in the comment section. I'm curious to know. I want to take a poll on what you all think the best one out of the 4 jobs. But right now, let's get into the video. Alright, so I am in the medical profession. As you all know, I am a 68 Quebec, which is a pharmacy technician in the military. This means that I work in the medical field. I've been doing pharmacy for the last 13 years that I have been in the military. But the gag is, if I would have known that there were other things out there besides pharmacy when I went away to MEPS 13 years ago, you can best believe I probably would have picked one of those other jobs, because pharmacy can be a doozy. But we're not here to talk about pharmacy today. I am going to let you all know what my top 4 medical jobs are that I would have considered had I known they were available to me when I went to MEPS. And I know most of the people in my comment section always talk about a medic, which is a 68 whiskey. This video is no downplay, no drag on the medics, because medics are vital, especially right now with what's going on with this pandemic. Medics are a vital piece of the military. Medics probably make up over half of the MOSs. So they're like the medics in the medical MOS, and then there's all the other MOSs. The medics are huge, and the medics will come for you. So please don't come for me if you're a medic. But I want people to know that there are other jobs out there besides a medic. Medic is not the only medical MOS. So my number 1 top pick, if I could turn the hands of time and go back to MEPS, my number 1 top pick that I would pick for myself is a X-ray technician. An X-ray technician is a 68 Papa. Okay, so let's take a look at the overview of a 68 Papa. The radiology specialist is primarily responsible for operating X-ray and related equipment used in diagnosing and treating injuries and diseases. Now, When I tell you the job of a 68 papa is not an easy task, because you have to think of it. That's a 24-hour job, just like my job. If somebody was to break their leg at 2 o'clock in the morning on a Saturday because they was drunk coming in from the club, they would need an x-ray. So that is a 24-hour operation. It's not a 9-to-5 job. So I just want you all to keep that in mind. If you want me to do a separate video of the pros and cons of these jobs, I will, but I want to keep it short. I just wanted to kind of list my top 4 jobs. So this next one we're going to talk about. Funny story, this was actually the second MOS that they tried to give me at MEPS when I went in, but I was like, no. So, and had I known now what it entailed, I probably would have picked this MOS, because I feel like it's a pretty chill MOS. This one is called a 68 Echo. 68 Echo is the Army Dental Specialist. It's responsible for assisting the Army dentist in patient care and treatment. The specialist prepares the patient for procedures and assists the dentist with any procedures and examinations needed. Specialists are also responsible for managing dental offices. When I tell y'all a career, you can build a whole career out of these jobs. This is why I tell y'all, pick a job in the military that's a stepping stone for something you want to do bigger and better. Why not be a dental specialist if you may have dreams and aspirations of being a dentist? What I'm trying to tell y'all, pick some good jobs out there. Do your research. Okay, this next job is a pretty chill job. When I say pretty chill, like, I didn't even know this was a thing. Like, I didn't even know that this was a thing, and people who go into this job are set up. Like, when I say set up, I'm talking about set up in a good way, set up for success. When I tell you, this job is called a 68 Foxtrot. It is an Army physical therapy specialist. Who wouldn't want to be a physical therapy specialist? Like, do you know how much hands-on on the job training you get being a physical therapy specialist, what you can do in future careers as a physical therapy specialist? It's almost like a physical therapist. Like, okay, let's read what the MOS entails. Army Physical Therapy Specialist complete patient care under the direction of a physical therapist. The physical therapy specialist works to decrease physical disabilities and promote physical illnesses. They assist patients following a medical referral and will supervise or administer the physical therapy to the patients. When I tell y'all, on the job training, if you just got to think, like, these people are busy. Do you know how many people they see a day? Like, people that get hurt, people that get blown up in combat, people that lose their limbs. Like, this is like a whole specialty right here, just dealing with amputee patients, and the military sees a lot of that. So this job right here, I feel like this is like an undercover gym right here. All right, so I didn't even know that this was a thing. Like, you know there's a lab, you know there's an x-ray, you know there's a pharmacy. I didn't know those were actually MOSs, but this one right here is like a diamond in the rough, like a low-key MOS. When I say low-key, like, I've been in the military for 13 years, and I just figured out probably like 5 years ago that this was an MOS, and I was like, y'all got a whole MOS out here? Like, this is like a whole job? I didn't know that this was a job that people can pick. So I feel like this is a chill job if you want to help people, but you want to do it in a low-key chill setting. So this job is called a 68 mic. Not to be confused with an 88 mic, because a lot of people out here are 88 mics and they hate their life. This is a 68 mic. A 68 mic is a nutrition care specialist. Just think about that. Let it sit in. Just think about what you would be doing as a nutrition care specialist. Let's read the overview. The nutrition care specialist works with registered dietitians, counseling patients individually and in group settings, plans special diets for patients according to nutritional requirements, and creates menus and prepares small quantity foods. Their job duties are to perform basic dietitian functions in a hospital, clinic, or field environment. So you just think the people that are having trouble eating, who are not having trouble eating, but say you're admitted into the hospital, you speak to a nutritionist to make sure you do provide that patient with the best food possible for them and their care so that they can recover. Somebody that may be in an inpatient setting dealing with like anorexia and those type of things. Like, you get a lot of hand-on experience in that small realm of that specialty that a lot of people just don't even think of or don't even see. You may see obese patients and you creating diet plans for them. People that are trying to get physically fit and like build muscle mass, like you have to create specific diet plans for those people. And those people see nutrition care specialists, and it's like I tell y'all, it's like a low-key like hush hush MOS. I did not even know that this was a whole MOS out here. I did not, but I'm glad they're there. I just wanted to bring these jobs to you all because you all see how excited I am about it, because I want you all to be in the know. I want you all to be able to pick the best job for you when you go to MEPS. When you go to MEPS, you need to come with a plan A and a plan B and even a plan C. In one of my last Military Monday videos, I talked about is now the right time to join the military. And if you have not seen that video, definitely go ahead and check it out. I'm going to leave it in the card up here. But I talk about why now is the right time to join the military. And these MOSs right here, they're going to be needing all of these MOSs with what's going on with quarantine and everything that's going on. So I encourage you to do your research, weigh your pros and cons, and try to think outside the box for other things that are available to you or might be available to you that you don't particularly normally see every day. And don't just go with the average Joe because you see them doing a MOS, you want that MOS. Because you see me doing pharmacy, you want that MOS. Okay, guys? Okay, I'm going to go ahead and end this video here. If you are interested in one of these MOSs, like I said, or if you had to join the military tomorrow and they asked you to pick out of these 4 MOSs, let me know in the comment section below which MOS you would choose. On that note, I'll see y'all in the next one. Bye.
Hey, if you want to see more videos like this, then make sure you hit that subscribe button. Like, what are you waiting on? Go now.